Good morning. Happy New Year. As I told you earlier, I want to see that all of you become very good in history taking. Why? Because I am convinced that the online consultations will continue even if after COVID disappears. You see, because it is going to be convenient for the patients. Patients come from so far and they spend so much money on the conveyance, and then they come and sit in your clinic for so long and they lose their money. They will understand that any day video consultation is better than going to your clinic. So I am convinced about it, believe me. So you have to become good in that. And fortunately, Corona has made you good in that. Why? Because in the past, most of the doctors all over the world didn't listen to the patient. If he says backache, X-ray, headache, CT scan. Now you have to talk to the patient. Take the history. And as I've been always saying, history will give you 85% diagnosis, if not 90%. The examination which you are missing gives you additional 5 to 7% diagnosis. And the final diagnosis, which is if it all missed, is given by investigations, 3-4%. Now that you can add to your history taking. So you can see 90-95% you can make an accurate diagnosis on the video consultation, provided your history taking is very good. In this year, 2021, I am going to see that I finish every subject of history taking with you. Today's subject is weakness. What is weakness? Patient says, "Doctor, I am feeling weak. For last 3-4 weeks, 5 weeks, I am feeling weak." But he can't show you. He can't show you where is the weakness. So remember that. Very difficult symptom to diagnose, and yet you can make it very easy if you follow few footsteps. Number one, really speaking, weakness is a complaint by neurological patients. Hemiplegia, paraplegia, monoplegia, paralysis. So paralysis, the patient uses the word weakness. Suppose I tell you, since morning my right arm is feeling weak. I mean, I could not hold the cup. Now, that does not go under weakness. That is paralysis. Onset of paralysis is going to increase. So think of transient ischemic attack. So neurological translation of this weakness is easy, and yet, believe me, the best of the doctors can go wrong in 3 neurological conditions. Number 1, Parkinson, easily missed. The patient comes and says, "Doctor, बहुत कमजोरी है, चल नहीं सकता है." How long? 2-3 महीना हो गया, 2-3 months. He can't walk, he is feeling weak. Weak? Show me your hand. Grip. Oh, he is so strong. Show me your hand. Walk. Put your foot down. His power is very good in all the 4 limbs, and yet he can't walk briskly like you. He walks slowly, which he calls as weakness. Right? Of course, it is weakness, but it's a weakness of Parkinson's disease. No investigation can diagnose except nuclear brain scan. I'll give you another example. The best of the doctors and the specialists can miss. Condition called as familial periodic paralysis. Rare. You might see one case per year. Young people. He's normal, absolutely normal. And he says, suddenly, see, the last patient says, slowly or through 3 months he was feeling weak. This patient says, suddenly, I took my breakfast, I was going to the office, and I felt weak. And he took a taxi and came back. He's in the house. These are called sudden weakness. All this sudden weakness is dangerous. Like headaches, last time I was telling you, the sudden headache, instantaneous headaches are the dangerous headaches. This patient can become more and more weak within few hours. And that time when you see him, you think, maybe nothing, maybe something. But by the evening he can't walk to the toilet. That means his legs are not working. So he has got paralysis. He's got paralysis, which he complained of as weakness. So, this is called familial periodic paralysis. It's related to potassium levels in the blood. You know, this potassium and weakness is a terrific link. Terrific link. Potassium is very good for all muscles, including heart muscles. So if the potassium goes very high, heart can stop. You die. Potassium goes very low, heart can stop, you die. Similarly, all skeletal muscles. If potassium goes high or low, muscles don't work. So this is another dangerous condition. Fortunately, it is self-limiting. Within 2-3 days, patient becomes normal. Without treatment. Without treatment. But I'm explaining to you how weakness and paralysis rarely you can miss for each other. I'll give you another example. There is a condition called as Guillain-Barré polyneuritis. It's a paralysis of legs and arms in young people, and the onset is acute. This young man says, or young lady says that since yesterday I find little weak and I can't go to the toilet. She can't go to the toilet. And when you look at her, you feel that she is quite strong. Neurological system is normal. No. You make her walk and see. Her legs are weak. This is the starting of a paralysis. Within a day or two, all the 4 limbs will get paralyzed. Guillain-Barré polyneuritis. Nowadays there is a very good treatment with gamma globulin, they can recover completely. So I am giving you examples that when patient uses the word weakness, you should not get caught in the neurological weakness, which is nothing else but paralysis. Paralysis, mild paralysis is called as paresis. Paresis. So coming to weakness. Today I am feeling very weak. See why? Because 14 days back I got a major surgery done on my knee. I lost 1 bottle of blood on the table. So I am recovering, I am feeling weak. What is the treatment? Nothing. Passage of time. That means weakness is diagnosed by associated symptoms. Associated symptoms. And that is the secret of diagnosing weakness. Like fever. Fever is diagnosed by associated symptoms. What else? Forget about the fever. What other complaint? So similarly weakness. What are the other complaints? From there you can diagnose the cause of weakness. No problem. But before I discuss that, there are certain things going on in the community of doctors. And that is, I don't know who has taught them, their fathers who are doctors, their uncles, their predecessors, their neighbor doctors when they started their practice, but definitely not in the medical college, that most of the patients connect, and the doctors connect weakness with low blood pressure. If somebody comes with weakness and the lady says, doctor, I am feeling very weak, otherwise everything is okay, appetite is good, weight is good, everything is good, then you record the pressure, 90 by 70. Oh, you got low blood pressure. Then she agrees with you. I also thought that I have low blood pressure. Then you give something, whatever you give, she'll become alright within 2-3 days, 4 days. This low blood pressure is not only in India, Germany is famous for that. You see, Germans don't like allopathic medicines because of side effects. So, when they get weakness, they record the pressure. Pressure is slightly low, 90, 92, 88, 95. They take Coromine drops without going to doctor. So this habit of associating low blood pressure with weaknesses for years going on, it has to be removed from the heads of the doctors, although it will be difficult to remove from the heads of the patients. You see, the blood pressure varies. You will not believe it. I have had patients in my clinic who have come from far and all that, and they're waiting for 2 hours before they see me. The blood pressure, 85 by 60. They're normal. They have no complaints. In all these patients, if you follow their pressure, the pressure always goes up and down whole day. Maybe in the afternoon or evening it will become 95, maybe 102. In private practice, low blood pressure in private practice has got very little meaning. It is a symptom of hospital illnesses. Please remember, a very important symptom of hospital illnesses. The myocardial infarction patient blood pressure is falling. The septicemia blood pressure is falling. That patient can become dangerous, he can die. In 48 hours the kidneys can stop working. Not in private practice. Forget about it. Just forget about it. You explain to the patient, this is your normal pressure. And people who have got low pressure, they live long. Similarly, weakness connected to high blood pressure. No, really speaking, this is wrong. How can high blood pressure cause weakness? Now, at the moment we are saying that 30% population has got high blood pressure. So are you trying to tell me that 30% population are feeling weak? They don't go to work? Wrong, absolutely wrong. There is no connection. Because high blood pressure is so common, and because he said, I am feeling weak, and you did not find any cause. So you want to find some cause. So you found high blood pressure and you are blaming it. Sorry. I would never accept weakness as a cause of high blood pressure. Yes, iatrogenic. Those patients who are taking drugs for high blood pressure, yes, it's possible that some of the drugs can cause weakness. You change the drug. Every medicine of blood pressure has got side effects. Every. If I have a patient like that, I'll stop the medicine, wait for 2-3 days, 4 days, nothing, change the medicine. So that is as far as the high blood pressure is concerned. Diabetes, same story. Now India is supposed to be the capital of diabetes in the world. So that means every third fellow will have diabetes, whole of India. So if anybody comes for weakness, you will diagnose that due to diabetes? No, diabetes is an incidental finding, incidental diagnosis. Don't connect it. If you connect it, he will become a headache for you. That patient will become a headache for you, because lifelong, anytime he gets weakness, he'll think it's due to high sugar. Yes, there is a connection of diabetes and weakness in patients whom you are giving medicines. Medicines are causing weakness. Insulin is notorious for that. They can get attacks of weakness, sweating, headache, drowsiness, etc. These are not due to diabetes. medicines of diabetes. So that much about the relationship with diabetes. Weakness and addiction to tonics and injections. And this has been produced by doctors over the years. 1970s, 65, 70, 80, 85, 90. I had a very large clientage of film actors. You'd be surprised. All these film actors used to take weekly B12 injections by their GPs. They'll go to the GP, because those days, see, the shooting was being done whole night. Those days, there was no day shooting, those days. So, naturally, you change the whole thing, sleep pattern is changed, you'll feel some weak. So they'll go and take a shot of B12 and feel nice. Those days, B12 levels were not done in the blood. In the blood, now we can do B12 in the blood and estimate. And the moment it is low, even whether that can cause weakness, I will be surprised, because one injection of 1000 microgram will raise the B12 like magic. Like magic. Even the anemia caused by it, up to 8 gram, 9 grams, will improve within few days. Similarly, tonics. Because doctor can't find any cause, he gives tonics to these patients. Then the patient becomes dependent on tonics. Tonics have nothing to do with weakness at all. Tonics are, as you can make from your clinic, you can put water and syrup and all, and give it as a tonic. What is wrong in it? And he will trust you, and he will always say, he's better. Weakness and sex, yes. A large portion of weakness patients who complain of only weakness. Now I am discussing only weakness. No other symptom. The appetite is good, the weight is normal, urine stool is normal, sleep is normal, they are earning well, they have no tension, they have no worries, they don't take tobacco, alcohol, this, that. Yet they are complaining of weakness. Now, I'll discuss further. Now, when I say sex means women, leukorrhea. Women are notorious in our lower middle class patients, female. All of them feel weak because of leukorrhea. In fact, nobody has taught them that normally there is a vaginal discharge, which will a little bit spoil your underwear. Leukorrhea is when you have to change your underwear 2-3 times a day. And when it is not whitish, it's a yellowish, frothy, smelling. That's called leukorrhea. So, that thing has to be removed from the mind, that leukorrhea is the cause of weakness. Now, night discharges. Once you see a young boy, high school boy, and he comes for weakness, weight is normal, the appetite is normal, everything is normal, blood tests are normal, 100% diagnosis is that he has night discharges, which is the cause. No, these night discharges occur at this age. It's not normal. Like a 14-year-old girl can start menstruating. This is a disease. The mother has to explain to her that now you have started this, it will continue lifetime. So similarly, when the boys start night discharge, that doesn't happen in our country. In the morning, the mother takes up the clothes and sees the underwear, and she sees the stain. This boy, then she'll show it to the father. See, your son, he's losing his semen at night and he must be doing something wrong. From there starts the whole circle, vicious circle. These people has to be educated. Now, in educated schools, in higher good schools, this complaint is not there. Between themselves they discuss, how often you have night discharge? Once a week. I got twice a week. I have. So they have no complaint. It's in the lower uneducated class that this symptom is seen. And similarly, masturbation. A college boy comes to you and complains of weakness. It's the only complaint, but normal weight, normal, everything is normal. 100% cause is weakness, masturbation. The masturbation is normal, because in olden days these boys used to be married at the age of 18, 17, 18, they were married, they were producing children, so they were having sex with their wives. Now the whole society has changed. Now they marry at 30. What will happen between 18 and 30 and 16 and 30? The semen which is being produced has to be removed. So you remove it yourself. It doesn't become a disease. It becomes a necessity. It is collected depending on how much TV you watch. And then remove it. Whether once a week, twice a week, nothing. But you should be confident that this cannot affect the health. And all such people, the parents should give them extra milk in the breakfast, 2 eggs, bread, butter, 1 piece of apple. Why? Because otherwise they go in, they start imagining, they start losing weight. This is the problem of masturbation. And then of course weakness and erectile dysfunction. It is a spot diagnosis. I remember olden days I used to talk about Pathans and all that. The most healthy people are the Pathans, very healthy. They're so tall, they're so broad, they're so strong, they're so God-fearing. They will never go out to women. They don't drink. And yet, when a person with that type of personality, heavy, tough looking, says, "Doctor, I'm feeling weak." And he brings all the 100 blood reports and investigations, all normal. The cause is erectile dysfunction. Many men in our country refuse to even talk about it. I have patients, like wives for example, of patients, and while I'm examining the wife, she tells me a little bit, "Doctor साहब, ज़रा उनको भी थोड़ा कमजोरी का इलाज करो." She complains of his sex weakness indirectly. Kamzori, she used the word kamzori. Then there is a problem in our country, in the whole world. There is only India where you get these complaints, dhatu. No other country has got this complaint. So no book mentions about it. Nobody talks about it. And nobody did any. I spent few years working on this problem. Initially I was going wrong. They used to think that semen comes out in the urine, semen comes out, they were feeling weak. And later on I have written a few papers, I have written my books also, explained dhatu is a disease of chronic prostatitis. And I became very confident of this diagnosis when the blood PSA levels came in the market. PSA is for cancer of the prostate. From 4, if it goes to 10, 80% chances is good, not 100%. But if the normal reading is 4 and if the PSA comes 500, 1000, 1500, either that patient had sex the previous night with his wife or somewhere, or he's got chronic prostatitis, chronic infection of the prostate. Very difficult to treat. Even the organisms like chlamydia is one of the organisms. In the past we had no test for chlamydia. So even if you give them antibiotics like chalu antibiotic, yeah, they will not improve. They need antibiotics specific for chlamydia and other things for as long as 6 months. Sometimes husband and wife both need to get rid of this symptom called as dhatu, which is nothing else but prostatic secretions coming in the urine, which make the patient mad. They go on looking at the urine every time they pass. They become a nuisance for the doctors who cannot diagnose. So, as I told you earlier, this potassium in the blood, more than sodium, Potassium. Potassium is very important for symptom of weakness. Weakness symptom, mainly affecting the muscles, not paralysis. If your potassium is low, you will feel very weak. So when the drugs like Lasix came in the market, we started seeing a lot of weakness. Then these pharmaceutical people started adding potassium to the tablet of Lasix. We usually tell them to take more fruit juices, soups which have got potassium. Yes, it's definitely a cause of weakness. In fact, potassium levels, if you find in a weakness patient, you feel confident. By the way, electrolyte levels of sodium potassium are not done by small laboratories, only by big laboratories. Don't send your patient to a small laboratory. Anemia and weakness. In lower class population, if you are in practicing the villages and towns, very poor people, all those women are going and working in the construction line, taking bricks up then whole day and all that. Hard working, thin, they have no money. If they come for weakness to you, 100% diagnosis is anemia. Anemia. You see, these people have developed tolerance. With 8 grams of hemoglobin, they can climb 3 floors 10 times a day. But weakness will remain. Weakness. So even on an online consultation, it's not difficult to diagnose weakness because you see the tongue of the patient. Then they show the tongue. If the tongue is white, pale, she's got anemia. But tongue can sometimes misguide you. The second method is to see palpable conjunctiva. Which conjunctiva? Palpable conjunctiva, not bulbar conjunctiva. For that you have to retract it like that and show it to the patient on the telephone. ऐसा करो, ऐसा करके दिखाओ. If you find that is pale, very good sign for anemia. Very good sign. And the third thing is the nails of this patient. If you see the nails are flat, normally nails are concave, and some of them have a concave nail. You can put a drop of water there. I can put 2-3 drops of water there. Such nails, flat nails, are indicative of severe iron deficiency. You don't have to do serum iron, TABC, ferritin levels, not necessary at all. That lady needs a capsule of iron, if possible permanently. What is wrong in it? Because she is menstruating also, she may be losing more blood. And that lady, if you give iron, her weakness will 100% disappear. Let her continue taking iron. So, anemia as a cause of iron, weakness. In the upper class society, even mild anemia, which cannot be detected clinically. So in mild anemia, the hemoglobin going from 12 to 11 produces weakness. So that is very important cause. Then we come to sudden weakness. If you remember the headache, sudden headache, every doctor should know, otherwise he'll go wrong sometime and you'll lose your practice. The patient who was normal in the morning, he went to the office, he comes in the afternoon and suddenly he becomes weak. I'm feeling weak. He starts sweating and he's restless. Restlessness is a beautiful sign. Remember that. He's sweating. He's saying, Kamzori. And he's sweating. And if you look at his face, it's becoming paler. Face is becoming pale. You don't have to see tongue and this. No. Face is becoming pale. These three things in a patient means he is bleeding inside gastrointestinal tract. Either he is bleeding in the stomach or he is bleeding in the colon. Very important symptom. And all this because of you, GPs are prescribing NSAID group of drugs to every patient. Nonsense. NSAID group of drugs are selective drugs to be used by selective specialists. Not for backache, headache, these, that. Paracetamol, finish. These drugs are notorious for causing bleeding. And when the bleeding occurs in the stomach is an elastic organ. So, half a liter of blood, nothing happens. 1 liter, nothing. 1.5 liter, even then it doesn't come out. So there is 1 liter lying inside without coming out. How will you diagnose? So keep a Ryle's tube as one of your hathyars, weapons. Every time anything is very easy to put Ryle's tube. Just put it in, see, is there any black or red blood? That's a diagnosis. Bleeding from the bottom. Very often there is no angiodysplasia, we call it. Colonoscopy normal, no cancer, no colitis. Patient may need a blood transfusion, may not need. The second is a patient who is likely to get myocardial infarction. That means what? I am discussing about a male patient who is middle age, who has got a very bad family history, who is a smoker, alcoholic, pot belly, does not do any exercise, and is only earning money. All day is working, earning money. Diabetes he has got, doesn't look after diabetes. He is the type who is going to get myocardial infarction. And especially when diabetes is already 10 years old, 10 years old means 70% chances he's already got heart problem. Without complaints, without symptoms. So if this man one day develops a gas in the chest, doctor, I've got gas, but with that he's sweating and vomiting. With the gas you can't vomit. And sweating, expensive sweating, he's got a heart attack. So same weakness can be cause of diagnosis heart attack. Similarly, sudden weakness in a known diabetic who is on drugs, extremely common. Middle of the night, patient wakes up by कमजोरी मुझे धड़कन हो रही है, palpitation, low sugar attack. Many diabetics learn, they keep sugar in the pocket. The moment you have any of these attacks, just take sugar, you don't have to call the doctor. You don't have to go to doctor. One of the commonest causes of weakness in diabetic patients. Every diabetic patient must have had a dozen attacks of low sugar in his lifetime. And then there is a complaint of sudden weakness with high fever. Sudden weakness, healthy person. Yesterday he was in the office. Today suddenly he can't go to office. And high fever, so high fever, body ache, viral. Virus fever is the commonest cause of sudden weakness. From that weakness we can die. Typhoid cannot cause weakness on the first day, not even on the 5th day. These patients, virus patients, become so weak that they can't go to the toilet. They can't. That's weakness. But very easy to diagnose. Very easy to diagnose. Now, if the weakness is associated with loss of weight, then one of the most important blood tests is your ESR. If the ESR is more than 30, that patient has got either tuberculosis, he is a young person, old man, look for cancer, or is undetected diabetes, or hyperthyroidism. Not very common, but I want to first tell you about this. The easiest diagnosis in medicine, easiest, is to diagnose hyperthyroidism. Doctors diagnose hypothyroidism. Half the population in Bombay, at least 30-40% are taking thyroid tablets. क्या डॉक्टर बोला थायराइड कमती है, डॉक्टर बोला थायराइड कमती है. It's all nonsense. That is based on blood tests, not on symptoms. We have stopped seeing symptoms of hypothyroidism disappeared because everybody is taking thyroid. But hyperthyroidism, more thyroid, is still seen. And yet in the books they teach us Graves' disease, exophthalmos, loss of weight. Wrong. Graves' disease is a very rare disease of thyroid, as rare as cancer of the thyroid. Hyperthyroidism, the commonest cause in private practice is called as due to subacute thyroiditis, virus disease of the thyroid. It is mistaken for sore throat. They go on giving antibiotics, there is something inside, the patient says slight pain, slight low fever, ESR is high. Nobody examines the thyroid. But if you stretch the neck and then press there, it's tender. That's called tender thyroid causing hyperthyroidism. ESR goes high, they lose rapid. So in thyroid diseases, the weight loss is rapid loss of weight. That is, I mean, this man is having fever for 2-3 weeks, he has already lost 3-4 kilo weight. No other disease this can happen, no. And of course, subacute thyroiditis is diagnosed by nuclear studies, not by sonography. Sorry. Then we come to diabetes. Undetected diabetes. Yes, naturally. Fat fellow, this, that point, he says he has lost 6-7 kilo weight in the last 3-4 months. Commonest cause is diabetes. Urine is full of sugar. Then we are left with two causes, TB and cancer. Cancer, of course, nowadays, a rich man, you want to exclude cancer, PET scan is the best to diagnose. Tuberculosis is difficult, that is the problem. In our population, tuberculosis is rampant. And lung tuberculosis is the easiest to diagnose by X-ray, X-ray chest. But glands here, nodes here you can feel, but what about in the chest? You can't feel. You can't even see them on X-ray chest. You have to have a CT scan to see these nodes here, glands here. Similarly in the abdomen, there's many nodes, which will be seen only on CT scan of the abdomen, sometimes on sonography. And once you see these glands, in a patient who complains of weakness and he has lost weight, there are only two possibilities, no third possibility. Two. Number one, tuberculosis. Number two, lymphoma cancer. Cancer in young patients. It's a cancer of young patients, not old patients. Now, you're caught. You'll have to prove the diagnosis. Therefore, we talk about biopsies. Any gland somewhere, take a biopsy. Send it for gene expert test. Gene expert is the latest test to diagnose tuberculosis. Even if chest shows glands, you can do CT guided biopsy. Because you must show that it's tuberculosis. Otherwise, how do you know it's not lymphoma? Which can kill you. Unfortunately, my practice has been always middle class patients. I have not seen very many high society patients. High society patients will accept all this and do any test what you like. But a middle class patient, you are telling him to do a CT guided biopsy of the nodes in the chest. Do you know how much it costs? 20,000 rupees for a diagnosis. I don't do it. I believe in his faith in me, in my diagnosis, clinical diagnosis. I tell him tuberculosis is rampant in our country. I think this is tuberculosis, but I can't guarantee you. We start the anti-tuberculosis drugs. Within 2-3 months, if you improve, diagnosis is correct. Finish. If you don't improve in 2 months, then we do further investigations. Nothing wrong in this. Nothing wrong in 2-3 months, nothing will happen. So, when the patient has lost weight and the years are high, you have to exclude these diseases. First, females, anemia with leukorrhea, which I told you earlier, is the commonest cause of. Then finally, some endocrines. Can endocrines be the cause of weakness? Yes, definitely, very much. But we don't see them. Hypothyroidism, diagnosed by high TSH, can cause weakness. But everybody is taking thyroid. Even if it causes weakness, thyroid, the patient will be increasing in weight, not losing in weight. So it's very easy to, and we don't see it anymore. Let me tell you. TSH is being done routinely like blood sugar in all patients. We will not miss it. Electrolytes, that I told you earlier. Every patient who is not responding, we want to know is sodium and potassium. And if potassium is low, you give him potassium, find out which drugs are producing that. If potassium is high, then you must find the cause of high potassium. It can kill the patient. Then he has to be investigated. Then we are left with only one endocrine gland, that is pituitary gland, with an adrenal. Pituitary is very rare, adrenal gland very common. In fact, tuberculosis of adrenal gland, so common. You see, in so many CT scans, calcified adrenal glands, you see, what are these? These are glands who patients with tuberculosis which healed up with calcification. They didn't develop any symptoms, but it can cause weakness, adrenal insufficiency. So you do cortisol levels in the blood. If they are low, all you give them is prednisolone tablet. Within 1 week, that whole weakness will disappear like magic. But such patients should be sent to a specialist. They might need lifetime prednisolone. And then we come to the last cause of depression. Extremely common. In my practice, I pick up as many as 1/3 of patients of weakness due to this disease called as depression. It is known as a psychiatric disease. But who separates psychiatric from organic disease? GP. This patient should go directly to a psychiatrist. They will never go, never. Because the symptoms are so mild. He is only feeling weak. He is only feeling, that's all. He will never go to a psychiatrist. It is you who are supposed to pick up this patient. And believe me, it's so common. And especially without any cause. Nothing has happened in the family. There is no financial cause, no trouble with his wife and children. Nothing. For no reason, he started feeling depressed. But depression in English is very easy to say. Now in Hindi, what will you say? In English, you will say, okay, we're feeling low. In Hindi, what will you say? Very difficult. Language problem. So if these patients are feeling, somebody is feeling weak, but the appetite is good, weight is normal, everything is okay, no other complaints, no cough, no fever, no loss of. Second symptom which will help you, you can ask him, does he feel low in the morning, especially in the morning? In the morning you feel low, don't feel like going to work, don't feel like going to, many of them stop going to work, and yet they don't diagnose. If you ask their sleep, many will tell you sleep is disturbed, not sleep like before. And if you ask them for the symptom of crying spell, one in a way you feel like crying. No, normal person, they will, yeah, sometimes, not common, but after you cry you feel better? Yes, better. These are the patients of endogenous depression with no cause. I will not call it a psychiatric illness. I'll call it a medical illness. If you start giving them a tablet of amitriptyline, 10 milligrams, 25 will cause drowsiness, you may not take. Start with 10 milligrams, 10, then 15, 25, but with 10 milligrams, if within 10 days, patient says he is feeling a little better. Your diagnosis is correct, finish. And then you have to give this tablet for about 3 months. And not for a longer time, most of them are cured. The trouble is this, in an upper society patient, educated patient, are you sure you are not missing something? Rich person. Best thing is, then you do the stress in this patient, which I told you in the whole lecture. Get a CBC done to see as you got anemia. Get an ESR done, ESR and CRP, to see if any organic disease you are not missing. Get a serum cortisol level done. Get a serum potassium done, sodium done. Get those 12 tests done which tell you weak liver, weak kidney, creatinine, liver, any other. Ask for X-ray chest. Ask for sonography of the whole abdomen. Spend on the test, no? When all the reports come normal, now you can announce to this patient, my dear man, you have got no organic disease of the, you have got only mind depression of your mind, and I can treat you. You don't have to go to a psychiatrist. But if with depression the symptoms continue, then of course that patient will have to go to a psychiatrist. Thank you.